Did you know that the medications you take every day, ones you might not think twice about, could be silently increasing your risk of a heart attack? Some of the most common drugs on the market, including those for pain relief, diabetes, and even birth control, have been linked to serious heart issues.
And the worst part?
Many people have no idea. In this video, we'll uncover 6 widely used medications that could be putting your heart in danger, without you even realizing it. Stay with us until the end, because understanding these risks could help you make smarter, safer choices for your health. Let's start with hormonal contraceptives, a method millions of women rely on daily. Birth control pills, patches, and vaginal rings are effective at preventing pregnancy, but studies show they can significantly increase the risk of heart attacks and strokes. A massive study involving over 2 million women found that those taking combination estrogen-progestin contraceptives had twice the risk of heart attacks and strokes compared to those not using hormonal birth control. And if you use a vaginal ring, the risk is even greater, 3.8 times higher. Why does this happen? These contraceptives can raise blood pressure, increase clotting risk, and strain the cardiovascular system. The danger is even more pronounced for women who smoke, have high blood pressure, or are over 35. So, what's the safer alternative? If you need birth control but are concerned about heart health, you might consider progestin-only options like the hormonal IUD. Unlike estrogen-based contraceptives, these have not been linked to increased heart risks. Next up, non-steroidal anti-inflammatory drugs, or NSAIDs. If you've ever taken ibuprofen or naproxen for a headache, muscle pain, or inflammation, you're not alone. But did you know these common pain relievers can also raise your risk of heart attacks and strokes? The FDA has issued strong warnings that the danger starts within weeks of use, and the longer you take them, the higher the risk. Some NSAIDs, like diclofenac, are particularly dangerous, while others, like naproxen, are considered somewhat safer. How do NSAIDs affect the heart? They can cause high blood pressure, fluid retention, and even blood clot formation, increasing strain on the cardiovascular system. If you have existing heart conditions or high blood pressure, be especially cautious. Even short-term use can be risky. So, what can you do? Consider alternatives like acetaminophen, paracetamol, or non-drug pain relief strategies such as physical therapy, stretching, and anti-inflammatory diets. Moving on to another hidden heart risk, thiazolidinediones, TZDs, a class of diabetes medications. If you or someone you love has type 2 diabetes, this is critical information. One of the most well-known drugs in this category, rosiglitazone, was once widely prescribed. But studies later linked it to a 43% increased risk of heart attacks. Why? TZDs work by improving insulin sensitivity, but they also cause fluid retention, which can lead to heart failure, swelling, and dangerously high blood pressure. If you're managing diabetes, don't panic, but to talk to your doctor about whether your medication is truly the safest choice. Newer diabetes treatments, like SGLT2 inhibitors and GLP-1 receptor agonists, have been shown to improve blood sugar without harming the heart, and in some cases, they may even protect it. These are just the first 3 medications on our list, each one commonly used, yet carrying risks many people don't fully understand. But we're not done yet. In the next part of this video, we'll cover 3 more drugs that could be quietly putting your heart in danger, including a medication you might be taking right now without realizing the risk. Stay tuned, and let's keep your heart safe.
Another category of medications you need to watch out for. Certain antidepressants. Millions of people rely on antidepressants to manage their mental health, but some of these medications could also be putting a strain on your heart. Let's start with tricyclic antidepressants, TCAs, a class of drugs that has been around for decades. While effective, TCAs can cause low blood pressure, irregular heart rhythms, and even increase the risk of dangerous arrhythmias. These side effects can be particularly concerning for people with pre-existing heart conditions. Then there are selective serotonin reuptake inhibitors, SSRIs, which are generally considered safer. But even within this category, some carry heart risks. Take citalopram, for example. Studies have shown that it can prolong the QT interval on an ECG. which can lead to serious, potentially life-threatening heart rhythm problems. Does this mean you should stop taking your medication? Absolutely not. But it does mean that if you're on antidepressants, especially TCAs or citalopram, you should talk to your doctor about monitoring your heart health. In some cases, a safer alternative may be available. Next on our list, pseudoephedrine, a common decongestant. If you've ever taken cold or allergy medicine, chances are you've used pseudoephedrine before. It's the active ingredient in many over-the-counter decongestants, working by constricting blood vessels to reduce nasal swelling and help you breathe better. Sounds harmless, right? Not so fast. This same effect that clears up congestion can also raise blood pressure, increase heart rate, and even trigger heart attacks in people who are vulnerable. That's why if you have hypertension or heart disease, you need to be extra careful with medications containing pseudoephedrine. If you're wondering what safer alternatives exist, don't worry. There are plenty of options that can help you manage congestion without putting extra strain on your heart. One simple and effective solution is saline nasal sprays. Unlike decongestants, saline sprays work by moisturizing and clearing out your nasal passages naturally, reducing congestion without affecting your blood pressure or heart rate. They're safe for daily use and can be particularly helpful if you suffer from seasonal allergies or chronic sinus issues. Another alternative is antihistamines like loratadine, Claritin. If your congestion is triggered by allergies, these medications can help by blocking histamines, which are the chemicals responsible for allergic reactions. The best part? Unlike pseudoephedrine, loratadine does not cause blood vessel constriction or raise blood pressure, making it a much safer option for people with heart concerns. For those who prefer a natural approach, steam inhalation is a great way to open up your sinuses and relieve congestion. Simply boil some water, pour it into a bowl, and inhale the steam while covering your head with a towel. Adding essential oils like eucalyptus or peppermint can enhance the effect, helping to soothe irritated nasal passages and promote better breathing. Other natural remedies include staying hydrated, using a humidifier, and elevating your head while sleeping to reduce nasal swelling. These small adjustments can make a big difference, especially if you're trying to manage congestion without relying on medication. Stay informed, stay